that sudden confusion in an older adult is not a normal part of aging, it could be delirium, a medical emergency that needs urgent attention. Delirium is a sudden change in a person's thinking, attention, and also awareness. It develops within hours or days, unlike dementia, because delirium is different from dementia, which develop gradually over months or years. They develop gradually over months or years. And older adults with delirium may suddenly become confused. They fail to recognize family members. They fail to recognize many things about them. They become restless or unusually sleepy. They see things or hear things that does not even exist, or they have trouble following conversations. These symptoms often come and go throughout the day. Delirium is usually caused by an underlying medical condition. It is mostly caused by an underlying medical condition such as infection. We have sepsis, urinary tract infection, mention it. We also have dehydration, medication side effects, surgery, low blood pressure, or low oxygen levels. It is the brain way of telling us that something is wrong. The brain is trying to pass a message to us that something is wrong somewhere. Many people assume that sudden confusion is just a sign of old age, but that is where we are all getting it wrong. Yes, we are getting it wrong. Delirium can often be treated if the underlying cause is identified early. Yes, it can be treated if the underlying cause is identified early. If your loved one suddenly become confused, or they behave differently from their usual self, do not ignore it. Take them to an hospital or seek medical attention immediately. Remember, growing older does not mean sudden confusion is normal. Yes, we need to get that right. Recognizing delirium in older adults can save a life. Recognizing delirium early can save a life. So you need to know that at UK Health Service Limited, we understand how frightening these certain changes can be. Our trained nurses and caregivers, they monitor older adults closely. Yes, we monitor our older adults closely. We recognize early warning signs. We support families. We encourage prompt medical evaluation when needed. Why home care is important? Delirium requires assessment and treatment by a healthcare professional. Yes, they require assessment.